Again, and with me I have a local activist. She's been very active in healthcare. We're going to hope that perhaps she can distill some of this for us so that we get a better fix on what the Affordable Care Act is and with what's going on in the healthcare system in the United States. So welcome, Alice. Good to have you on the show to kind of distill all of this for us.
That's
Let's see, do we have about 3 hours?
Exactly. Okay. Well, actually, one of the things that I'm going to talk about that is somewhat different from the Affordable Care Act, but I will compare
Single payer, right? We're going to go talk,
Yes, and a lot of people don't know what that means. Yeah. So if I explain it as improved and expanded Medicare, that might give people a better idea. Medicare is one of the best things we have in this country, and it's resulted in saving the lives of our senior citizens, and it's the kind of system that you see in every other developed country in this world. If you look at the international data, what you find is that we are 37th in the world in terms of health outcomes. And on every barometer, our Americans die younger. We have more infant mortality. We have fewer.
I was surprised about the infant mortality.
Yes.
I was really surprised at that when I heard those figures.
Well, when you think about it, we have so many poor people in this country that are not covered. They have no health care. And for example, my daughter is a obstetric gynecologist, and she works in the Bronx, and she sees many mothers who do not come to the hospital, have not seen a doctor until they're ready to deliver. And as
you don't even know what the problems are then.
Exactly. And as a result, the care is extraordinarily more expensive than a normal birth. And part of the reasons are because our healthcare system is so expensive. It's the most expensive in the world. So
because I think because the insurance causes the physicians to have more tests, more this, more that.
Yes.
And it just kind of feeds on it.
Well, what makes us distinct from all the other developed countries is that ours is driven by a for-profit insurance system. And built into that are huge administrative costs. And so the insurance system is driven by the stock market, and as opposed to its first incentive being to care for and cure people. Medicare, on the other hand, has 3% in administrative costs.
That CMS isn't CMS that does that? Yeah.
Yes, yes. And also, there's a great deal of accountability and visibility, which you don't have in private health insurance. So millions of people cannot afford it. And in fact, even my neighbor has terrible physical problems, but she doesn't go to the doctor because
too expensive.
Yes. So what has this to do, for example, with the Affordability Care Act that was recently passed, or what people call Obamacare? There are some good things in it. Allowing children up to the age of 26 to be on their parents' policies, if their parents have insurance. Not allowing preconditions to exclude somebody from getting health care.
That was a terrible thing.
Yes. And also, you have health care for life. So those are the good things. The weaknesses, though, and they are real, is first, it doesn't cover everybody, okay? And I just heard on the news this morning that many of these youth that were, young students who were given an extended stay to be able to go to school, go to college, and not be deported will not be covered.
I saw that in the paper, yeah.
Right, will not be covered. But it goes even further than that. It's anticipated that 30 million, up to 30 million people in this country will not be covered. But also, people are required to purchase private health insurance on these exchanges. And there are no restrictions on healthcare costs. So that to get the bill passed and to not have it opposed by both the insurance and pharmaceutical industry, there were no cost containments. And for example, in 1999, for a family, a policy would be $5,000. Today, it's over $11,000 for family. Many people can't afford it.
If your income is $25,000, $11,000 is not going to.
Absolutely.
You can't afford it.
Exactly.
Yeah.
So some people,
So Medicare for all, or the single payer plan, would be what you see as the solution.
Yes.
And you are not alone, because I know so many physicians that are looking at it, and Arnie Ritterbrand and many of the physicians out there are saying the single payer plan is really the way to go.
Exactly. So you hear cries of it's socialism. Well, then the most socialist healthcare delivery system we have is veterans care. And would anybody call for dismantling veterans care? Veterans care is actually one of the best of all the healthcare delivery systems in this country. So you have Medicare, Medicaid, veterans care, and then you have these millions of people who fall through the cracks who will not be in a position to be able to purchase an expensive policy. So in the long run, it could make the outcomes worse. Better in some areas, but worse in others. And if you do not purchase a policy on the exchange, you're fined. You pay a penalty.
So you can't afford it anyway, and now you're paying a penalty on top of it. It's like, wait, I could use that to pay for maybe one doctor's visit or something.
Exactly, exactly.
Well, it's certainly a challenge, and I can't imagine what any governmental agency that's looking at these, try to put this together. It must be just challenging, not because we can't find a solution, but because there are so many lobbyists working against these solutions.
Yes, that's true. That's true. And so this idea of putting profit before health care distorts the system and, in fact, makes us a much unhealthier population. And when people are unhealthy, they're not productive, they die younger, we have enormous obesity that other countries don't have.
It's a cost on the system. It's a cost on our society.
Exactly.
Because maybe they can't work because they're too obese or this. I mean,
exactly.
There's so many pieces that we can put together. And I don't know, I've been in the healthcare field for all my life. And so I've seen basically it's the lobbyists that get out there and really, when you find a solution, they come up with why it can't work.
Right.
So, yeah.
Well, you go into your doctor's office and you will see stacks and stacks and stacks of files, a whole wall of files, and you'll see a large administrative staff. And what they're doing is they're fighting on the phone, and doctors fight on the phone with the insurance companies.
Absolutely.
Why won't you cover this? Can that be covered? No. What can we do about this and that? And
if you could get all that out of it, they could concentrate on having medical staff that takes care of patients.
Direct care.
Right.
So let me tell you a little bit about.
Well, we're almost out. We're out of time. So I'm sorry.
Oh, I didn't get to talk about what we're doing.
Oh, okay. Well, quickly, just tell me real quickly, because
our organization, we're grassroots. If you have any of those photos you want to show, we lobby, we educate, we demonstrate. I just want to mention that New York State now has a bill that has been co-signed by Assemblyman Richard Gottfried and Senator Duane, and it is a single-payer bill for New York State. It's called New York Health, and we're working on this to. Okay,
good.
Thank you.
Okay, good. Yeah, we did show them. Okay, good. Thank you so much, Alice. Wait, sit down.
I'm sorry.
We're just kind of tight on time today. I'm so
Sorry.
sorry. We've been speaking with Alice Brody. She's an activist talking about the single payer plan. Check it out. Learn a little bit more about it. You might find that this just might be the solution.